I'm Sue Waltermeyer. I'm a certified child life specialist, and I've been here in Southern Nevada for 35 years. And I'm a parent of a child who's had a medically complex childhood. I was the first child life specialist in the state of Nevada. I was recruited from California when the headhunter called the hospital I was at and said, they're looking for a child life specialist in Las Vegas. My response was, there are children in Las Vegas. Las Vegas, Southern Nevada has been a demographic of retirees and not necessarily a demographic of families with young children. But certainly in the late 80s, when there was a huge population boom and a lot of construction and growth, families with children moved here. And prior to that period of time, if a child needed a subspecialist in healthcare, they either had to be treated by an adult physician or go out of state because there wasn't a large enough children's population to support a specialist establishing a practice here and be able to make a living. Even back in 1990 when I arrived, there was talk of a freestanding children's hospital in our community, and different committees and campaigns over the course of the years for that to happen. Nevada is number one in the country for-profit hospitals, and I think that's created some challenges for having comprehensive health care for children here. My daughter was born prematurely with a cancerous tumor and spent the first 4.5 months of her life in the hospital. She also had a little bit of a heart issue. She had an eye issue, so right off the bat we had oncologist, an ophthalmologist, and a cardiologist, and a nephrologist because she had her kidney removed. It's been really challenging when she's had so many different providers that are all in separate practices and don't necessarily communicate well together. At one point we were battling to get her a medication that we felt very strongly she would benefit for and needed, and I spent hours and hours on the phone with insurance trying to get approval for it. And my husband commented one time after listening to me for an hour advocate for the necessity of this medication, but she needed it. And I'm savvy enough in medicine that I knew the terms to use and the reasons for the medication and the benefits of it, and we finally got it approved. My husband said, what do parents do that don't know what you do? And I said, they give up. Their child doesn't get the medication or the treatment that they need and would benefit from. I'll give an example of a parent taking their child to an ER because there's something wrong, and the ER can determine that this child needs to see a subspecialist for what they're presenting for, and maybe that subspecialist in our community isn't contracted with that hospital. So rather than telling the family, we can't provide that for you here, we can transfer you to another hospital in our valley, or we can discharge you with a referral to this specialist who can help you, they just say it's not available here, we're going to transfer you to out of state. And so now you've taken a family out of their community where they might have support and resources. You've oftentimes split up a family. You've sent them to a community where they don't have support and resources, and made them, seek treatment that they could have had available here. And, I think there's a real misunderstanding in our community as a whole about what is available here, because we do have some really good healthcare available here. And a lot of times I think the knee-jerk reaction is get the hell out of Las Vegas and go to a big state-of-the-art medical center. I'll give you the example, my daughter had cancer, and I've worked in pediatric oncology for almost 40 years and part of pediatric oncology, COG, Children's Oncology Group. But what that means is that if a child presents, say, for leukemia, which is the most common childhood cancer, they can go anywhere in the country and they'll be offered the very same therapy that is available here in Las Vegas, because we're all part of the same group. When I told my daughter I was going to be coming here and kind of sharing her story, she said, well, what are you going to say about me? And I said, well, let me tell you why I'm talking about it. It's because we need a children's hospital here, and what that would look like for you is, instead of having to go to Henderson to the endocrinologist, to the middle of town for an ultrasound and scan, to the west side for one specialist, back to the middle of town for the cardiologist, I said they'd all be under one roof. Oh, that'd be great, she said. I said, I know, it would be great. It's really hard when you're a parent who has a child who has multiple subspecialists. And I'm a working mom, so having to take time off to go to all these appointments is difficult because, they're all in the same hours that I work. And when my daughter was in school, we tried to not disrupt her school by taking her out of school to make appointments. So we try and get those afternoon appointments at the specialist office, which is the appointments everyone wanted. So, it's just very challenging to make it work smoothly for your family. And I can't imagine families who have multiple children with medical needs. So, research has shown us that these siblings of chronically or acutely ill children have trauma from that experience in their childhood. Their normal childhood is disrupted. I had an experience once of running into a family who I had worked with many years ago when their daughters were like 10 and 12, and I ran into the mom and the daughter, and who's in her mid-20s now, and the mom said, oh, back then you played the piano, you were so talented, I thought you'd do something with that. And the daughter just looked at her and said, my sister got sick, we couldn't do piano lessons anymore. And kind of just the realization on the mom's face of, wow, that is sad. You had real potential, and that derailed that for you. So it's not just, the child diagnosis, the whole family gets impacted by this. Often one parent needs to not work so that they can manage all these medical appointments and, communicate between all these facilities, because they don't necessarily communicate well with each other. They all have their own electric healthcare records that don't interface with each other, and our practices are so overwhelmed that it's hard for physicians to take the time to follow up with a referring physician and tell them what they're doing on their end when they've, they're on call and they've got to, do hospital rounds and see patients, and, it's overwhelmed for sure.
What would a statewide children's healthcare system really do for families?
Wow, it would remove so many impediments and delays and obstacles to children receiving the best care possible. I would envision it as something that supports the whole family and not just the patient. I'll use an example of a children's hospital I was at in the last year for a conference, and their cafeteria had climbing areas inside in between tables and stuff, so that little kids could climb and explore and be little kids. They had outdoor play areas. They had even the roof of the hospital. There was, like a metal garden there, so that they weren't looking at pipes and machinery kinds of things, that they had something, nice to look at, that there's play spaces, because children, that's what they do, is they play, and that helps them to work through things that are difficult for them. It helps distract them from the things that are scary or hard. It promotes their normal growth and development in an environment that may stunt that. We hook up children, toddlers, to IV pools and things, and toddlers, their job is to explore. They want to be climbing and looking, and they forget they're tethered to this pole and they just kind of take off. And so I think you can create environments and programs that allow them to be toddlers and get their healthcare needs met at the same time. An environment where families are supported, where parents can go with their children into the OR for anesthesia induction versus just the medical team doing what the medical team needs to do. It doesn't always incorporate into it time to be comforting and nurturing, and I think that's important. How can we support those families in the environment when they need to have conversations with the healthcare providers who are on rounds and have 5 minutes and then they're going to be gone? You create spaces for siblings where they can be supervised and then have time to be with the ill child and communicate with the healthcare team so that they're not distracted and they can concentrate on the answers to the questions that they have. So just really thinking about what does the family need. The hospital I visited had an IT bar where families could bring their electronic devices and get apps uploaded to help them manage their children's healthcare records, where they could get some free services for their electronics so they could stay connected to their child and their healthcare team. just little things like that make such a difference. And the great providers we do have, they get burned out after a while because they have to spend part of their day arguing with insurance companies about providing the care that they know their patient needs. And it takes away from their time to take care of the patients and have those conversations with the family. So we need a healthcare system that's going to let the experts be the experts instead of somebody behind a desk who isn't a pediatric subspecialist and may not even be a pediatrician. I think, there's so much that can be done here, and it would be so amazing I think Nevada could be a state-of-the-art icon in healthcare. And I think it would be amazing if we became the diamond in the desert for children's health.